Hi, Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Having braces put on a child can be a very hard decision to make. There's different reasons for having a treatment such as braces on teeth, whether it's a deformation because of a genetic disease or things of that nature. But to get us all straight on what's a good practice and what can be some of the problems with braces and how to take care of those things is Dr. Sophie and Sayfo with Uncommon Orthodontics. And welcome to the studio, Doc.
Hey, welcome.
We're really happy to have you here today. And to help parents understand, and children of a younger age, young adults even, who are thinking about getting braces, they might want to learn what are some of the challenges with those, what might be some side effects and ways to counter those things. What's one good reason for a young adult or even a middle-aged adult to get braces?
So the most important thing that people come to get braces is usually aesthetic. They want their teeth straight. They want their smile to look better. The problem that we face is, the biggest problem we face is compliance. And to be more specific, it's compliance with oral hygiene, brushing, keeping your teeth clean. And with that being said, the biggest problem that we face, and honestly, we face it during the treatment, but the patient doesn't see it until the end of the treatment, is usually what we call it white spot lesions.
How do these white spot lesions present on the teeth?
That's a very good question. So you might not be able to see them as the patient looking at your teeth. I usually try to point at some signs that we are kind of like we are in a kind of a dangerous zone. Hey, we need to pay attention to brushing and taking care of your teeth so you don't get it. But the second we take the braces off, you will see a very distinct square, white, square, chalky look at the facial surface of the tooth. And that's exactly the parameter where the bracket was sitting.
Okay. And what causes those white spot lesions?
Mainly, it's related to the food being trapped around the bracket. Braces, in particular, because they are glued to the teeth, present a challenge of keeping the area clean, brushing, flossing, and all those kind of practices. And the patients sometimes neglect them for a long time, and the food get trapped there. And because of that, the food get fermented, make some leftover products like acids, and then cause demineralization, which is taking the minerals from the facial surface of your tooth and causing this kind of look.
So during the time that a patient has those braces applied to their teeth, is just like you said, the good oral hygiene, flossing, and things of that nature.
Yes.
Is there anything about diet they can do?
Mainly is the oral hygiene, but the diet is very important. Now, let's talk about the oral hygiene for a second. It's because the food get fermented and forming acids. Now, if your diet is heavily, acidic, let's say you drink a lot of soda, or you drink a lot of acidic drinks or sport drinks or something from this nature, you will have the same problem. Now, you have to adjust your diet, and you have to brush regularly, floss regularly, and the most important advice that I give to patients, try to use water pick. It cleans between the teeth, under the wire, around the bracket. It does really good job.
Is there anything over the counter that a patient can purchase once they've had their braces removed and those white spot lesions are evident? Anything they can purchase over the counter as far as toothpastes or things like that?
We always recommend a toothpaste with high content of fluoride. But honestly, that's during the treatment. That's to prevent it. When it is there, it takes long time to remineralize, and sometimes it doesn't. Sometimes it requires some intervention in the dental office to kind of like fix that problem.
And when you talk about remineralization, is that the toothpaste and other things that they can apply?
Yes. If it is a mild lesion, yes, remineralizing, it's a kind of like an interesting word, to remineralize the tooth surface by the toothpaste itself and the content of fluoride and other minerals in it sometimes work. But if it's really significant, you have to have some dental intervention. Sometimes you have to have some bonding, which is like we kind of go in and take a thin layer of the surface of the tooth, and then we cover it with composite or any kind of like aesthetic material. There are some technologies now that some materials can be applied to those lesions, and it infiltrates those areas and then kind of mask it and cover it and fill it and makes it look really, really nice. But it's still, we are talking about an intervention in the dental office.
Hmm. And then is there anything even more drastic than that that would cause or that would require some type of abrasive treatment?
Yes, worse the case or kind of like a more extensive the damage, then you need more kind of like a dental intervention. You have to take more tooth structure to reach a layer that is more like healthier, and then you put your restoration there. It could be as simple as bonding, and it could be as far as crowns sometimes.
And is there a treatment? I read up on this. Is there like a microabrasion?
Microabrasion is kind of like if it's very, very, very mild and you just need to go in, and if you take just this kind of thin layer, outer surface of the tooth where you can kind of like grind this area that is chalky and white out, sometimes that works, but that's very, very mild cases.
How often do you find, Doc, that once a person is finished with their braces treatment for realignment, that they choose to, whether they've experienced white spot lesions or not, decide they're ready for veneers for the color?
I see it more often than I would like, to be honest, because the treatment, the ortho treatment takes time. It's a marathon. So most people arrive to a point, especially teenagers, they drop the ball, they stop brushing, they don't brush properly, they brush whenever they feel, teenagers, we can understand that. We've been there sometime, at some point. And that's the problem. You tell them over and over and over again, and then the second you take the braces off, you clean the teeth, the first look in the mirror, they start asking me like, what is this? It's like, that is your final exam result that we were talking about it for the whole time. Like, brush your teeth, and that's what you're gonna get. And I'm sorry, but you are now facing the consequences of not brushing during the treatment.
And then once those braces are removed and white spot lesions and other things are taken care of, isn't there also a requirement for a patient to wear something like at night to help keep that alignment?
Yes. Now we are talking about kind of like a retainer to keep the teeth where they are as a retention protocol, but that's all patients across the board, regardless if they have white spot lesions or not.
Okay. So to kind of get to the bottom line, if we can, Doc, and to help alleviate some anxiety amongst parents and younger patients, then what are the positive outcomes of a braces treatment, and how dangerous are the side effects?
If we follow the protocols and we keep the teeth clean, we brush them regularly, we adhere to good measurements of oral hygiene, I think every person should get some good outcome from their ortho treatment. It's either aesthetic, or it's even functional, or sometimes affect or the occlusion gets better, it's more comfortable, it's more stable, and it always leads to good result, again, as long as we adhere to the oral hygiene protocol during the treatment.
Right. Doc, if somebody wanted to come see you for a consultation on whether braces are good for them or not, or for their children, where would they find you?
So that's a fantastic question. First, our consultation is complimentary. We don't charge the patient for the consultation. We do a very comprehensive exam, including photos and x-rays, and we sit with the patient and break it down and give them treatment plan. And they can always find us in our office. It's on Range Line next to McAllister. You can look it up at uncommonortho.com or find us on social media, Facebook and Instagram.
Okay. Anything else we need to add, Doc?
No, I mean, you can always come check us out and do this complimentary exam. And if you are in braces, please listen to this and brush your teeth.
Dr. Sophie and Sayfo, for being with us today from Uncommon Orthodontics. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Thanks for watching.